This is Dr. Yui Sakseo, plastic surgery specialist in Area 88. Lower eyelid fat reposition, fillers, and lower blepharoplasty are the most common options for treating wrinkles under the eyes. In particular, lower eyelid fat reposition is one of the most commonly done operations, and many patients come believing it solves everything. Fat reposition under the eyes may be suitable, but more often they are not. For related videos, please refer to the links in the description box below. Today I will discuss cases lower eyelid fat reposition won't be suitable, and also cases where filler has been previously injected to the mid-cheek and tear trough. Patients usually bring up lower eyelid fat reposition to deal with wrinkles, tear troughs, and bulging fat under the eyes. Up till the time of this presentation, it was really told this method can solve the tear trough, improve the mid-cheek and even the nasolabial fold. Since then, more detailed classifications and anatomical studies have emerged, and surgical methods have changed accordingly. One of the discoveries is that tear troughs and hollows under the eyes are not just made of areas simply sunken. Fat layer under the eyes comprises the shallow fat layer in pink and the deep fat layer in green. These deep fat layers are called suborbicularis oculi fat, aka SOOF. It is usually explained tear trough and hollows under the eyes are a result of sunken regions caused by sagging ligaments. There is an error here. Although not shown in the figure, most tear troughs and lower eyelid grooves are caused by the difference in thickness of skin shown by the arrow and the shallow fat layers. Fat reposition is done by moving fat under the eyes to the sunken areas as shown in the picture on left. Theory like this still dominates and appears very plausible. However, as shown in the ultrasound image, the red arrow area does not improve just because fat has been transferred to the yellow arrow area. One cannot approach lower eyelid surgery from the shallow fat layer in pink. If done so, ectropion will occur. Thus the SOOF layer below in green is lifted, lifting both the thick skin and the shallow fat layer in pink. This black line shows the periosteum, firm membrane surrounding the bone, and there are cases endotene is inserted there to lift. Endotene is a plastic-like material that dissolves, inserted as shown in the picture. Inserting it diagonally like on the left is not suitable for Asians as it makes the cheeks bigger. So I use the method of raising it vertically as shown on the right. Since the periosteum where endotene is inserted is a very firm region, in order to lift this layer, an incision in the mouth must also be made for a wide dissection as so in green. What's more problematic is that just because the periosteum shown in black line is lifted, the skin and shallow fat layer above it does not also lift. In fact, by lifting the periosteum the cheekbones may look larger, and there could be damage and more sagging caused by complications from the wide dissection. This is a photo of filler injected to correct wrinkles under the eyes. It's of a young patient, and if you look below the eyes, you can see the tear trough and some protrusion. If you look at the ultrasound, you can see a fair amount of filler has been injected under the eyes and mid-cheek. The tear trough and its border, marked in star, look more prominent because of fillers. In this case fat reposition is not a solution. In fact, problems may look even worse. Lower blepharoplasty and SOOF lift was done to address the issue. This is 2 months post-operation. Scars are worst at second month and begins to better after 2 months. Scars like these become invisible later. A bit of the border is still left on the right side where filler had been injected in the mid-cheek previously. Many people believe filler disappears on its own or can be dissolved, but this isn't true. You can't dissolve them all, and even if they're the soluble kind, they may not melt even after 10 years. As explained earlier, the black line on the left must be raised to the blue line on the right to solve the tear trough and sunken areas. This is SOOF lift. Various treatments and surgical methods are done to improve wrinkles and tear troughs under the eyes. It is necessary to clearly know the cause and then perform the treatment or surgery. Although filler is a simple procedure, simply filling sunken areas does not resolve issues like those from earlier. Also, no matter how skillfully injected, areas that can't be corrected just can't be corrected. Rather, problems occur trying to correct what can't be with filler. Also, people think filler can be dissolved or go away on their own, but they do not. Fat reposition too, is only effective when there is fat to be repositioned, thickness between the skin and shallow fat layer isn't too thick, and skin isn't sagging. Fat reposition isn't the solution to all. Due to too many disadvantages in inserting endotene below the periosteum such as damage to the retention ligament from extensive dissection of the periosteum, protrusion of cheekbones, and the need to insert a screw for fixation, I do not use this method. Today I've spoken on lower blepharoplasty, SOOF lift, endotene below the periosteum, and filler. Next time, similar to these topics, I will discuss endoscopic facelift and dual plane surgery using Endotene. Thank you.